Clearing up the Ebola crisis, that is the goal of new guidelines from the CDC this morning. They follow another suspected Ebola case. This one is in Baltimore. The new rules explain how people returning from West Africa should be treated in the United States. They outline when it's appropriate to quarantine travelers and healthcare workers.
Meanwhile, Australia is the first major country to ban all visas from West African nations stricken with Ebola. It's a controversial move that is facing backlash. Jericka Duncan is at New York City's Bellevue Hospital. That's where the most recent patient is fighting to recover from Ebola. Jericka, good morning.
Good morning. Dr. Craig Spencer remains in serious but stable condition here at Bellevue Hospital. Meantime, there is a patient in isolation right now being monitored for Ebola at the University of Maryland Medical Center in Baltimore as U.S. officials continue to work to contain the crisis.
Not everybody's at the same risk, so they stratify the risk.
The new guidelines issued by the CDC classified travelers from West Africa into 4 different risk categories:
high, some, low but not zero, and no identifiable risk. And then they match the risk to the kind of restriction.
Healthcare workers who treated Ebola patients using personal protective equipment pose some risk, while those who came into direct contact with body fluid will be considered high risk. And they will be directly monitored by public health officials for signs of infection. Their movements in public will also be restricted, but a quarantine is not automatic.
Is this person reliable to adhere to the restrictions of not traveling in certain types of medium, of not going into crowded areas? If there's a determination that that person could do it, technically you could put a restriction on that person.
Meanwhile, Casey Hickox, whose quarantine in New Jersey sparked widespread criticism, was released Monday. The nurse who recently returned from Sierra Leone was whisked away inside one of 2 black SUVs to her home in Maine. A 5-year-old New York City boy who recently returned from Guinea has tested negative for Ebola. Medical personnel in full hazmat suits removed the sick child from his family home in the Bronx late Sunday night. Despite the negative test, officials were not taking any chances initially.
The child at first did not appear to have any symptoms. The mother has no symptoms whatsoever. So a lot of caution is being taken here.
He's now being cared for here at Bellevue Hospital, the same hospital where Dr. Craig Spencer continues to receive treatment for Ebola.
And right now you see a picture there of Amber Vinson. We're just getting word that she is expected to be released from Emory. She, again, was a nurse who was diagnosed with Ebola. She is going to be released later today. But despite the new guidelines, there are still some inconsistencies at the federal level. A major general in the Army said that he and his troops are returning back from Liberia and are being isolated at their base for 21 days. Charlie?
Jericka, thanks.